धन्यवाद.
Thank you, sir. Thank you very much for creating a positive vibration as well as and I can say the energy in the
Aura.
beginning of aura in the beginning of 2021. I wish each and everyone a happy, prosperous, healthy 2021, and I welcome you all. There are many participants are there. Many are with us on the platform. It is more than 100. Actually, it is not sufficient, the spaces, but that's why we have made available. This thing is the live on Facebook. If others are there, your friends may be inquiring them. You can ask them to join in the Facebook. They can see very lively the same quality and same nature. I welcome today's our main resource persons, Dr. Professor S.K. Tiwari sir, as well as Dr. Muktinder Singh sir, and I welcome our patron Dr. B.D. Patel sir and Chairman Dr. Swami, and all our office bearers, President, Vice President, Secretary, Joint Secretary, and other members, as well as the many senior practitioners who have joined today. I am seeing many are there here, like Ishpal Singh ji and Sakshipal, Bhamina Sharma, I don't know. So many are there. I welcome you one and all for a very interesting webinar today, the challenges of pediatrics. And it is my sincere and honest request that please join us by making a homeopathy more stronger, this organization. And now I would like to introduce today's our first resource person, Dr. Muktinder Singh ji. He is a director of HomeoCare, a classical homeopathy, especially dealing with pediatric cases and behavioral problems and autoimmune disorders and advanced pathologies. He is having a more than 25 to 30 years of practicing experience as well as teaching experience. He is working as a professor in Ludhiana Homeopathic Medical College. And very interesting thing out of all these things, I will tell you, so thorough gentleman and treating the cases very confidently, inspiring the students. Today's our both speakers are like that only. They might have been made many students to practice homeopathy successfully and guided in that way. And where now, just now, the Dr. Muktinder Singh was telling to even Dr. Tiwari, sir, he is more senior than him, where he was also telling that we have learned from you. See, that is the thing. Even at this age as well as stage also, he feels that he is a beginner as well as a learner. That is a very interesting and a good-hearted, a kind nature person. When I called him to present a paper, he was, sir, आप order कीजिए. See, that's the order me. That is the simplicity, down to earth simplicity. And he has been working for the many years for so many organizations. Just not just a member, he is a leading organizer. And by the same time, he has presented many cases in nationally and internationally also. And even he conducts the classes for international students. That is a very interesting thing. And professionally, he has enriched this knowledge, and he has been given awarded like Lifetime Achievement Award by Delhi Board of Homeopathy, awarded as Best Motivational Speaker by F. Sahib Trust, Director HomeoCare, a chain of pediatric specialty running clinics all across India, is a trustee mission. Paigam Isai Guru, a non-profit organization, one of advanced faculty and mission member of IHP, and so many other things where there are many things are there. I think by this, I would like to introduce Dr. Muktinder Singh ji for the today's webinar. Sir, I request you to start now. Please, sir.
Sir, full screen.
Sir is mute. He needs to unmute himself.
Hello.
Yes, sir.
Yeah, am I audible now?
Yes, sir. Yes, sir. We can hear you.
मेरी जगह से उधर हो जाएगा.
आप कौन?
Yes,
So,
sir. Now we are audible.
good afternoon to all the seniors first. I pay my regards to Dr. Samuel Hanneman, then my seniors, Dr. B.D. Patel sir, Dr. Hegde sir, Dr. Tiwari sir, and many more seniors who are here, whom I could not name. So first of all, I thank this Karnataka Doctors Association to invite me for this. And I was telling just now that presenting in front of seniors is always a challenge for the juniors. So I'm junior to them. So it is definitely a pressure on me to justify. But we all are homeopaths and we are talking about homeopathy. That gives me the confidence. And also, I would like to invite the international participants. My friend Dr. Kulwant Singh Uppal, he is heading that faculty of homeopathy. We all know the name of Dr. Fisher. So he had that organization which is serving in UK. So they have the members all over and they have officially shared our brochure. Dr. Hegde sir, for your knowledge, they have officially shared our brochure on their official page and website. So many European has today joined, and I'm getting hundreds of messages that it's only 100 people room, we are unable to join. So I have motivated them to join on Facebook.
Yeah, sir. Please. Please.
So
you can
those
tell
who
your
are
other students or anybody followers are there, they will message that. I have put already.
Yes, all those who are not able to join, please tell your friends that they can join by on the Facebook Live.
Yeah.
And another, I would say, as you are saying, so I can see in the screen, many doctors from Malaysia has already joined. Dr. Bob Lim and many more has already joined in this 100.
I saw that.
So congratulations to you, because now it's an international webinar. You have labeled it as national webinar.
Sir, already. Thank you for your compliments.
So now coming to my topic today, I have been giving that what are the challenges in pediatric cases. So we all know that pediatric cases, we all have less exposure to pediatric cases. We have very poor training and infrastructure in our education system for the dedicated cases, because even if we have a syllabus, but we hardly have any IPDs and those challenging cases which come to our peripheral practices, but in our institutes we are not getting that kind of pediatric cases which can enhance our skill. And another challenge is that we have very limited dedicated literature of homeopathy, of pediatric especially. We have Burnett's writing, we have few indications through which we get only few remedies to which materia medica we can explore. And another challenge is that all kids look alike. When you see at a kid, you just feel a very affectionate, either the kid is crying or kid is smiling. This is the two things. What else to observe? How to find a constitutional remedy in case of kids. So I would be talking, and above that is we have very kind of education or kind of practice we have made is more of prejudice type. Means we have aloes for the diarrhea, we have PULSATILLA for coryza. So that kind of practice has definitely harmed the, or has affected the quality of result and the potential of homeopathy which we can show to the world. So I'll be not taking these points, but just biggest question asked by freshers and even practitioner to me is which materia medica to follow to understand kids. So I would try to answer this question, that rather than pointing out or putting a finger on a single materia medica, we have to develop a kind of skill to take out the pediatric understanding from the whatever literature we have. Because if you talk of, many people say that why don't you write a book? I think that adding more volume of books, we already have abundance of literature. I am a strong believer that we should, rather than creating more literature, what our creation of literature is, either we are theorizing or we are just speculating, making stories, or what we are doing is we are compiling from here and making a book on my name. I am not in favor of that kind of literature. I believe that even if I write a single article in my lifetime, but that article should be evergreen. whosoever reads it should get more enlightened. So how to take out of our classical literature the pediatric understanding? This I would try to exhibit today. So perceiving the case in toto, we know that is the answer, that when we are looking at a pediatric case, we just what we do is, I'll demonstrate that we just take a case, we repertorize the case, we reach to the remedy and prescribe and forget. That's all. Okay, we got the result. But to get those results consistently, how can we get those results every time? We need to perceive in a different context. So that I would be executing. First, I'm starting with a case. This was a case of 8-year-old girl who was brought to me with the very panic parents. Those were, because at that time they were told that the problem their child is suffering is a severe autoimmune problem. It is called Still's disease. So this was a case way back in 2013. So I have a 7 years long follow-up of the case. So I can say that yes, this case can be relied upon. Still's disease is a disorder featuring inflammation characterized by spiking fevers, salmon-colored eruptions that comes rash that comes and goes, and arthritis. Still's disease is also referred to as systemic onset juvenile idiopathic arthritis. So a skin, and most of the time it is thought that it involves the inflammation of internal organs. So a disorder featuring inflammation characterized by high spiking fever, salmon-colored rash that comes and goes, and arthritis. So this is what the important is. You can search about the disease. So I'm not going into the details of the disease. The chief complaint, girl child brought by parents with complaint of fever with rash since last month, cough and weakness. So she used to get very high fever. And above that, when we face the pediatric cases, the biggest challenge is handling the parents. In my practice, treating a child is easier than handling the parents. So the parents are always, this father of this girl was Googling everything. At that time, Google was not that readily away. 7 years back, I'm talking. Still, he came up with at least this big printouts of the papers about the Still's disease, about its complication, and about autoimmunity. So this father was knowing more than me about the Still's disease, because I was to Google, because this is not a very common occurring disease. So father was more familiar with the disease and its modalities than me. But as a homeopath, so I took the history as per our protocols. So this was told by the parents that firstly rash appear on skin, and left arm is affected first, and then right arm, and then thighs. This was the pattern of the eruption, appearance of the eruptions. Colors of eruptions was reddish, skin complaint seemed like urticaria, but that was not exactly that, because it was not a nettle rash, it was more erythematous, deep colored rash. At that time, no itching, no pain. Sometimes eruption become big and on touch feel burning, as if heat. At that time, cetirizine, they give cetirizine and the eruption settle. But other part is fever. The fever, it has no definite pattern. Patient has cough also. If the cough continuously, then whole body become warm with rashes over skin. So whenever she coughs, the skin eruptions, they become more prominent. No definite pattern of fever, mainly afternoon and after 4 p.m. Hungry after fever. Feet remain cold, fever during, redness eyes before fever, sobbing, weeping. So this kind of history you can easily get. The physical generals are appetite normal, tolerable, desire cheese, curd, rice, ice creams, non-veg versions, because no one in the family had, only father takes, so the child dislikes that. Thirsty, chilly towards, inacute, otherwise is not that chilly, he is ambithermal kind. Stool is normal, urine eruption and itching near genital area is there. Sleep is normal, dream, sometime weep while sleeping. So this is her particular dream, that during, since this has started, this symptom has come very prominently, that she is sleeping, and while sleeping she will start sobbing as if she has been badly crying, and she weeps during sleep only. And when woke up, she forgets everything. She does know, I don't know that I was weeping. Mental journals are anger, she gets angry easily, anger interpolative, has to console her, very egoistic bacha, feels herself superior than other students, feels superior in study or her writing, conscious about her looks, and she is very self-motivated in studies, very quick in answering, not very obstinate. She is very obedient and a diligent child. They, and she dominates over her maid because she say she'll command the maid. Fear dogs, lizards, likes wandering, not so much mischievous. So she is a obedient, very good child. Can stay at home alone, sensitive to self-esteem, to her comparison. So when parents compare her with others, she feels bad. Physical sensitiveness is towards tight clothing around neck, can't wear. Internally, she is strong. She was comfortable when fever was 103. So when she was brought to me, so the fever was 103°F. But she was very comfortable. She was talking to me. Only thermometer was telling that it's a fever. Otherwise, the symptoms with that cold feet and that those who were verified by the parents. She likes appreciation very much. Now we all know how to proceed. We definitely good remedies, sensitive remedies, they come to mind. So I'm not going into the details. So I took the symptoms. That coldness of feet was one symptom which was told. Her body language, even when she came, was very haughty and weeping aloud with sobbing. While even there was some reason, so she whenever she weeps, there's sobbing. So I simply repertorized the case. So these were the remedies which came into the repertorization, like coast ammonium sulfur, pulsatilla, ignatia, nux vomica, conium, and phosphorus. I'm running fast because I have to tell something else. So adding to it, appetite increased, fever after. So medicine given was ignatia 1 m. After giving ignatia 1 m, that child started showing some improvement because spikes were lower. Earlier it was going 104 fever, but then it started, next day it was maximum 102, very next day it was 101. Then so it took almost 4 days and fever subsided. Eruptions were no more there, only chest and those joint pains, they remained for a week. And after that, all her C-reactive proteins, all her ESR, and every autoimmune parameters, they settled down. And within a month or so, the child started going again to the school, because they were not sending her to school because someone was saying that it is a rheumatic fever, so child will not be able to, but all those parameters were not a confirmed case of rheumatic disease. So but now what happens is that all that we take the symptoms, we give the remedy, and we give the indicated remedy. This is what we all are doing. But what happens is, time is less. Otherwise, I could have demonstrated this with more cases where I failed with the same approach. This is one of the approach we take. So we think that that's all, that we take the rubrics, we repertorize, we take the case, we analyze the case, we repertorize, we differentiate the remedy, and we give. But sometimes we have to see, we stop here, that this is the pattern we see and we prescribe. But we don't see the bigger picture. What is that bigger picture? This is now I'm coming to how to get the materia medica out of our existing literature. That is what my main focus is. So there's a class of kids which are sensitive, like this. Now this child was very sensitive child, who was sensitive to being compared, who was sensitive to being scolded, who was sensitive. So where remedies, which I already told, was came to my mind. So what are this? In internet, if you search, you'll get and very many articles on this sensitive kids. So now here, what is important is not that I prescribe Ignatia. Here I see a case which is a group of cases. There is a deductive logic and inductive logic applied into our understanding. So what did is that this child was like other children, like other Ignatia prescribed and he cured. But we need to understand the bigger picture. So otherwise what happens is, I presented this case in one of the workshops. So most of the people, they start talking that it's so if you see the picture, that what are the sensitive kids? So sensitive kids are which are capable of perceiving with sense or senses, responsive to external conditions, stimulation, susceptible to the attitudes, feeling, or circumstances of others. So they are quick to take offense, very touchy, easily irritated, sensitive skin, sensitive person, one who held to be endowed with psychic or occult powers. So there's a category of highly sensitive kids. They are 15 to 20% of whole kids, born with a nervous system that is highly aware and quick to react to everything. Now, this child, what was the cause of this child was that the parents were a bit dominating, and she was taking those things very sensitively, and she suffered with an autoimmune disorder in such at the age of just 8. So what was the reason was her sensitivity. So we get sensitive kids around us. I would demonstrate it further. So this makes them quick to grasp subtle changes, prefer to reflect deeply before acting, and generally behave conscientiously. So these are the kids who are very conscientious kids. They are very easily subtle changes posing. I remember a kid. Once my stethoscope was, I replaced my stethoscope because kids were handling it every time. So he never touched my stethoscope. He was always sitting with the mother. But he said, "Doctor, where's your stethoscope today?" So they once I was another girl. She used to come to me. She said that, "Okay, doctor, do you have, why are you recording?" There's no camera. So what happened was, at that time, a few years back, so I had a camera and I recorded an artistic case before that case came in. And one of the lens of my camera was lying under my desktop, on the screen of desktop. So he took it that if there is a lens, doctor must be having camera. And if doctor has camera, he must be recording. So doctor, you're a photographer, you record. So just a 6 years child, just from a cover of the lens, making out that I recorded something. So that is something. And there are, so they are very precise, and they are very conscientious, and they are very quick to grasp subtle changes. They are also easily overwhelmed by high levels of stimulation, sudden changes, and emotional distress of others. So because these highly sensitive child are blend of a number of temperament traits, these children are fairly difficult, active, emotionally intense, demanding, and persistent, while others are calm, turned inward, and almost too easy to raise, except when they are expected to join a group of children they do not know. But outspoken and fussy or reserved and obedient. All HSCs are sensitive to their emotional and physical environment. So this is the group of children. It is not just Ignatia or carcinosa. There is a huge group, almost 50 remedies I have taken out from our Materia Medica, where we can talk of these highly sensitive kids. I'll be showing you that. So what are the indications that a child is a highly sensitive child? So child who started easily, even infant. So what we do is, we are in a habit of jumping to the remedy. So if you find some startling easily, we start thinking of only Kali group or Borax or few remedies we talk, or Medorhinum. But this just can be a symptom. But if you see the bigger picture, that child who started easily, complained about scratchy growth, seems in socks or label against his skin, means his skin is sensitive to touch, doesn't enjoy big surprises. So they just cannot take the big surprises. They'll start weeping, or they'll just so go numb, and they will start interpreting it other way. Learns better from a gentle correction than strong punishment. So if these kind of kids, usually some parents, they are in habit of strong. So I once remember a family coming up with a ADHD daughter. The first child was ADHD daughter, but the second child they got was a very sensitive kid. So as if they used to shout or punish their ADHD child, this child used to fall sick. So rather that was an ADHD child, but this child used to fall sick only, if supposing if that or that girl, their ADHD girl is doing something, and they are saying that don't do this. So, but she will continue doing this, but this boy who was very sensitive stopped doing all that. So they just need not punishment, rather just gentle correction, or you say something to the else, or there is a message, or you are even talking on home, they catch on those things and start correcting themselves. So they don't need punishment, but if punished, they get sick. So seem to read my mind. Parents say that they are very mature child using big words. So what we do is, supposing I this symptoms, so I'll take a Kali group or the first, or very sensitive, or that skin arsenic or Kali cup again remedy. So gentle correction is sensitive to punishment, I'll go to that only that group of remedies. So then I'll, if I take these two last symptoms, so I'll start taking about the premature children, precocious child. So notices the slight unusual order, have a clever sense of humor, seems very intuitive, hard to get to sleep after an exciting day, doesn't do well with the big changes. So if you see, there are different remedies coming up. So, but do we need to think of only remedy or a picture as a whole? So what are the indications of highly sensitive kids? They are bothered by noisy places, notices subtleties, sometime that's being moved, a change in person's appearance, consider if it is safe before climbing high. Very cautious kind of kids, perform best when strangers aren't present, feels things deeply. So wants to change clothes if wet or sandy, ask a lot of questions. So many a time I have seen that practitioner, they stuck up this inquisitiveness. Sometimes it is not. So you start searching the remedy out of those 5-6 inquisitive remedies given into your repertory. But if you see the bigger picture, so that is, in general, is a highly sensitive kid. So if you take, rather than taking those 7 remedies rubric, if you take those 50 remedies into consideration, you're getting the right remedy. Chances of getting the right remedies go very high. So they notice the distress of others. So many times, even 2 days back, one of my student, he called me, he was earlier practicing with me. So, sir, what is the rubric I should take for the child who takes a lot of care of the parents? So I have taken the full of cares worries, but is it right rubric? Now, this, if a child is a sensitive child, so it constitutes around 15 to 20% of the all children. So they will have all these traits. So sometimes you will start confusing within the toggling between the rubrics, and sometimes you miss the bigger picture. So they prefer, they notice the stress of others. If some I remember once, my daughter is a very sensitive child. So once one of the child, her colleague, so her mother was very sick. So those days that girl was not very well, and she got fever out of it. So they notice the distress of others, prefer quiet play, ask deep thought-provoking questions, very sensitive to pain. So these are the sensitive kind of. So if you get any of 2 or 3 symptoms in a child, so you don't think of taking these rubrics, rather than think a bigger picture and then see whether the child is a sensitive child, because it is not only important for the point of prescribing also, but it is important from point of counseling the parents that your child is a sensitive child, so you need to handle the child in a different way. So they have to alter their parenting. If you are bringing up a sensitive child like other obstinate children, so what happens is parents inadvertently start punishing them or start scolding them. They don't like to be talked loud, so they have their own needs. So you are able in a position to counsel or to educate the parents that you need to handle this child more. This is a fragile child, so you need not to handle a glass as you handle a steel glass. So you have to handle a glass made of glass rather than a metal glass. So that is different attitude and different attire you have to adopt. So if you handle these sensitive children, positive tone, or the way they should be, so they become a successful children. Otherwise, their child, most of the children brought to us out of whole kids, These are 20%. But in a homeopath's practice, if you 20 kids, or if 100 kids or 10 kids come to you, out of those 4 or 5 would be these high kids. So our practice, in my practice, I have seen in my pediatric practice that more than 50% sometimes cases belong to this category because they are sensitive. So what we earlier, what I was, till I realized my mistake, I was taking these scattered rubrics and try to prescribe. Now I have formed that. First, let us see that whether, as I'm giving you an example, what happens is, supposing there's a case of OCD. If you are taking this continuous washing behavior or fastidious rubric, you cannot say solve all the cases of OCD by taking this fastidious rubric. Though all OCD cases are fastidious, mostly there's hardly any case which cannot be fit into the fastidious definition. But do you think that only 20 remedies can handle the OCD? There are 100 remedies which can handle the OCD. So to handle an OCD where there is an obsession, where there is a compulsive behavior, if you search them firsthand, so our repertory has very few remedies. Our Materia Medica has hardly talked about OCD. But there are, in my practice, I have hardly prescribed arsenic to an OCD patient. But if you go to the diagnosis and see the disease symptom, arsenic is the only most indicated remedy. Syphilinum, arsenic, these are the remedies. But my successes came through anacardium, natrum sulph, lycopodium. So the remedies which are not in those kind of rubrics. So if you see, understand the disease as a whole, then you individualize 2 OCD patients or 5 OCD patients you have by keeping their common symptom aside and then taking the individuality in the part. Same way, if you understand that this is highly sensitive kid, so you take out all these symptoms which, as I have told, aside, and then look out for the remedy in that child. That will give you a precise value. You can hit the bullseye. So I have differentiated some of the remedies. So these are the major sensitive remedies I have seen in my practice: aconite, agaricus, antim crude, antim sulph, antim tart, so all antimonies, then belladonna, borax, all calcareas, calcarea, carb, phos, silicata, all these are there. Carcinosin, causticum, other kalis are also there: kali phos, kali carb, even kali sulph. So all these groups you are getting in this, you can get. Natrum group is there. All the belladonna, stramonium, veratrum, they come under the sensitive. Nosodes like tuberculinum and all the, so if you find of mineral, other mineral, phosphorus, so all these remedies, they are coming into this group. So what I have done in my practice, what is the sensitive remedies? So we have either sociable kids or non-sociable kids. I will be taking that some other day. So if you found of sociable kids which are sensitive, means those who are very easily communicable kids, those who come close to you in your practice. So all those kids are belladonna, phosphorus, carcinosin, crocus, tarantula, tuberculinum, aconite, agaricus, coffea, caliphos, lycopodium, opium, stramonium, teucrium, and stannum. These are the kids which are sociable and approaching kids. Other group is most of the remedies, which sensitive remedies fall into this second group, which are not very social, which are reserved type, which are introvert type, non-adaptable to the situation. So carcinosin, chamomilla, cinna, ignatia, which we have prescribed, natrum mure, pulsatilla, aconite, antim crude, calcarea phos, kali carb, kali phos, medorinum, nux vomica, Staphysageria, tuberculinum, antim tart, calcareas, China, gelsemium, lyco, opium. So all these remedies, platina, borax, causticum, phosphoric acid, stannum, stramonium, they come in the category of non-sociable kids. So out of those adaptable kids, now what we think is, you don't think that all the sensitive kids, they are diligent. There are adaptable, non-diligent kids also. So they are sensitive. So these are the remedies. Medorinum would come into that next group. So belladonna, phosphorus, tarantula, opium, agaricus, and caliphos are the kids who don't work, who are not good in studies, who are not very obedient, they are hyperactive, still they are very sensitive. While carcinosin, coffea, lycopodium, stramonium, sternum, they are diligent and very sensitive. So another is non-adaptable, non-diligent and diligent. So carcinosin, Ignatia, Staphysageria, Nux vomica, Lycopodium, Calcarea, acid fast, stramonium and sternum, they are the diligent, non-adaptable, withdrawing remedies. While non-diligent, Natramure, Kalika, Medorinum. So Medorinum is the remedy which is non-diligent and very sensitive. Natramure also very not diligent but very sensitive. Tuberculinum, Pulsatilla, China, Califos, Nux vomica. So all these kits, they are very sensitive but not very diligent. So talking about Ignatia, Ignatia is Dr. Hegde sir, please tell me the time when I have to conclude. So I'll take those remedies. I'm going fast so that I can deliver the maximum.
Yes, sir. Sir, still time is there, sir.
So till what I have to conclude, it's 3:50 now.
Another 10-15 minutes you can take.
15 minutes. Okay, thank you. So Ignatia is a remedy which is withdrawing hyperactive, mental and non-aggressive remedy. So Ignatia kids are not usually very aggressive kids. So they are chilly, thirsty or thirstless, one-sided. So can be right-sided or left-sided, very diligent and obedient. So these are the kids who always are very sensitive to the marks they get. They are quick, alert, very fast remedy. So if you read the first line of the Ignatia, quick to perceive and fast to act. This is what is told about the Ignatia. So they are the kids who are very sensitive, who brood silently. They are easily hurt, but they will never express their feeling. So if they are hurt, they will not show their feeling. So very sensitive to punishments. So if they are punished or reprimanded or criticized or reproached, so if they are compared with or criticized that you have done this wrong, so because they are already taking care of everything. So even if mildly scolded, so what they will do is they will start brooding over. So if you want to know a sensitivity of the remedies, because these sensitivities has to be understood to individualize the remedies from our materia medica. So we have to see that what are the sensitivities of a particular remedy. So those two kind of rubric, either if you search from the repertory, you will get the sensitive rubric, sensitive. So if you get those sensitive remedies, so and second is ailment from what ails a person is also its sensitivity. So ailment from like grief. So Ignatia is a remedy which gets sick after some grief, after some sorrow, where they cannot cry. So Ignatia will get more sick if there is a grief and he cannot cry. So they are affected, they are sensitive to punishment. In children, supposing if child is brought too early to bed, so if they are forced to sleep in time, they want to study, they are in a mood to play. So the parents force them to study. So they simply say, okay, go to bed. So if the child is like a murk, so he will just be mischievous, or Alexis would manipulate the things. He will pretend to sleep and but not sleep. Once the parents leave, they'll again start doing mischiefs. But an Ignatia person, the child, he means if mother has said to sleep, so even if she doesn't want to sleep, she will go to bed. So that means parents have scolded, so she will feel bad. Admonition kindly, death of parents. And important is what are the reactions of Ignatia? How the reactions? So because this sensitivity and reaction pattern is the best tool to individualize a remedy. So if an Ignatia person is affected by grief, he will start weeping. And what would be the peculiar of weeping? It will be a continuous sobbing, shrieking sign. So these are the type of the weeping that will get. Either he will get angry. So when he will get angry, when if they will be consoled. Supposing the parents have punished a child or reprimanded or talked aloud with the child. The child is sitting on the corner. So when the mother will come to console, she'll just throw the shoulder back. So they get angry when consoled, or when they are reproached. मेरी गलती नहीं थी, मेरा नाम लगा दिया, मेरा नाम टीचर ने मेरे को, वो किसी और बच्चे ने गलती की थी और टीचर ने मेरे को भी उनके साथ डांट दिया. So this is being reproached. मेरी गलती नहीं है, फिर भी मेरा नाम लग गया. So this is the sensitivity of Ignatia. And another sensitivity which we find in repertory and materials is jealousy. When baby takes attention, a new baby takes a family attention. So Ignatia jealousy would be shown in form of being more diligent. So that is how we have to understand. And if you search into repertory, the Ignatia sensitivity, so they are sensitive to light, they are sensitive to music, they are sensitive to noise, they are sensitive to odors, sensitive to pains. So what I'm trying to depict here is that if you understand the sensitivity part, so this is a long presentation, that's what I was asking about the time. So there are every remedy, all these remedies, they have different pattern of sensitivity and reaction. Once you understand the sensitivity and reaction print, it is like the fingerprint of a remedy. Every remedy has different reaction to the same sensitivity. Every person would take up the different thing from the same situation. So that is what the sensitive. So Dr. Praveen and my friend, his Materia Medica is very good in that. So if you get this Ignatia, so he has given it in that, I'm skipping this. So usually diligent, obedient child, when they enter clinic, they will avoid any confrontation and will sit nicely on the chair. She'll be quiet, non-communicative, but very attentive, listening to everything that mother is saying. She will not laugh much and appears serious. She will answer to the point and very sober. She falls ill when somebody in her class performs better than her. This is what Dr. Vijekar has told in one of the seminars, and even it is in his book. So Ignatia will get sick if even his single mark is, the supposing teacher has checked, and even she is getting less, even 1 mark less will give them an acute. So they will suffer the next day. They will not tell the mother, the child coming from the school and suddenly having, because it's vast remedy. So in the one of the periods, the teacher told something to the child, or he was not listened to because she attempted the right answer, but teacher ignored or was not able to evaluate her exam well. So if the teacher is not listening to her argument, so then she will rather not argue. But even if, because Ignatia is a remedy which is also listed in injustice cannot tolerate. So Ignatia will go to the teacher, would ask the teacher that you have not marked my questions well. So if the teacher refuses, the child will come back home with acute fever or cough or coryza or diarrhea, whatever the. So this is how, what the sensitivity of the Ignatia is. So very intelligent, very studious, very competent, quick refinement. So he wants to achieve goals. So, but he's non-expressing. So reaction is non-expressing. And difference between Staphylococcus and Ignatia is, Staphylococcus will pent up his anger. I'll give you a slide also. And Ignatia will be feeling bad, but Ignatia will be feeling angry. Staphylococcus will feel angry and not show his anger. Ignatia will feel bad and not show his grief. So this is the major difference between Ignatia and Staphylococcus. So disappointment excite inner sensitiveness, but they try to keep it to themselves. Inclination to grief without saying anything about it. So Clark says nurses her sorrows, keeps them from others. If you shout at her, she will feel hurt easily, but will not express her sadness. You can see a small drop of tear in her eyes. So Natramure and Staphylococcus, but Pulsatilla will weep loudly. So Natramure and Staphylococcus, if feel bad, Ignatia, if they feel bad, they will not show, they will not cry loudly. But Pulsatilla will start crying very loudly. She might show hysterical reaction like deep involuntary sign. Very touchy children, as I've told. So melancholy. So you can read this into the Dr. Praveen and Materia Medica. So this is how he has explained beautifully about the toddler of Ignatia, infant of Ignatia, schooling child of Ignatia. So the reaction to stimulus. So when they They are non-expressing, uncontrollable crying because sobbing is there. They'll try to control their child will cry little but later sobs a lot, to blame herself for anything wrong happening, very often to child of proper poorer parents who is doing quite well on scholarship and now cannot do as well as she did. So start to reproach herself, thinks that failure is due to lack of effort on her part. So like an Orm child, like a cyclamen child, this child will start blaming himself for his failures. So on examination, they will start sighing, sobbing, as I already told. So these are the physical PQRS, so you can take. So I'll now compare Ignatia and Staphylococcus. So both remedies, where they come very close into our repertory. They both are sensitive, both are diligent, both are chilly, both are thirstless. So these are the similarities. But how to differentiate between Ignatia and Staphylococcus? Ignatia is a sensitive remedy, while Staphylococcus is also very sensitive remedy. But reaction of Ignatia to some criticism, to some scolding is grief. Usko dukh lagega, bura lagega on being reprimanded or scolded. But on being reprimanded, Staphylococcus will just make the fist, clench the teeth. So he will just come home with a rat, with an abdomen pain, acute abdomen. So this is the difference. Ignatia will feel bad, but not angry, while Staphylococcus will feel anger, but control is anger. So cry, sobbing type in Ignatia, while Staphylococcus is control and angry type. So even if he weep, there would be anger. So the nucleus of the Staphylococcus lies in anger and controlling the anger. Staphylococcus is a very angry remedy. That's why in some of the rubrics you get that anger is expressed sometimes. But usually the Staphylococcus comes to us with that control over anger. What do you need to control? If you have a speed, you have to control the speed. Same way, if you have too much anger, out of dignity, they will control their anger. And this control in anger, Chamomilla will not control his anger, he will show his anger, while Staphylococcus will control his anger. Hyacinthus will not hide his sexuality, but conium will hide its sexuality, so fall sick. So controlling an emotion sometimes makes person sick, because if emotion is very strong and you are trying to control it, that control will make the person sick. So Ignatia shun away from the situation with wet eyes. Supposing something is happening to the Ignatia, he will just leave the situation with wet eyes. While Staphylococcus might stay there with clenching teeth and making face. He will still stay there. He will be just trying to control his anger, not showing his reaction. But you can see that he is not comfortable. Ignatia will rather walk away. Ignatia is very sensitive to her image and grades, while Staphylococcus is sensitive about hurt and ego. So the issue is ego in the Staphylococcus, while Ignatia, it is the performance. So hungry during apyrexial stage of fever. So Ignatia will get hungry after the fever, apyrexia. But Staphylococcus is hungry during the fever. Our patient, which I have prescribed Ignatia, was also showing this symptom that after the fever, she feels hungry. But Staphylococcus will eat well even during acute. That is a very peculiar symptom of Staphylococcus. Now, if you compare Ignatia and Cocculus, they are again very same remedies, very close remedies. So both remedies, they are common in sensitive, non-expression, emotional, diligent, obedient, sentimental, homesick, anxiety, conscience. If you put all these rubrics, you'll get Ignatia and Cocculus both. But how will you differentiate these remedies into clinic? That Ignatia is a more thirstless remedy, while Cocculus is more of the thirsty remedy. Now, differentiating remedies only on mentals is sometimes very risky, because mind is more of subjective and more of the perception of the doctor. But this thirsty and thirstless, or the sidedness, they are more conclusive and more decisive and more reliable points to differentiate the remedies. So Ignatia don't express in extent of dignity and self-control. Ignatia, like Staphylococcus we have talked, they will just have their ego and dignity. While cocculus, they don't. They understand the situation but never react. They perceive that something is going wrong, but still they are so weak inside. So they have no strength to show emotion due to weak will. Ignatia doesn't have weak will. He has self-control. That cocculus has weak will. So righteous anger and indignation is there in Ignatia, while cocculus like pulsatilla would yield to the situation. So cocculus is more yielding. So Ignatia in acute present as dull and sad on surface, while the cocculus will show as a weakness and slowness. So Ignatia is a faster remedy, cocculus is a slower remedy. Ignatia is very responsible, quiet and formal, like Orm, but cocculus is very caring in nature, like nurse, like carcinosin. Ignatia is also like carcinosin. Ignatia feels hurt and react as grief, while cocculus gets frightened, so withdraws. So cocculus is a frightful remedy. डर जाता है कॉकुलस. इग्नेशिया को बुरा लगेगा बट वो शो नहीं करेगा because of his self control. But cocculus will feel bad, will be caring to the person who hurts rather. So they withdraw because they get frightened. डर जाते हैं, like pulsatilla. They say that we are not strong enough, so better to withdraw. So they withdraw out of their weakness. So Ignatia has no specific inclination to music and singing. While you find this, they are sensitive to music, Ignatia, but they are not inclined to music. While cocculus has inclination to sing. Cocculus is there in drilling, that kind of cocculus do, but Ignatia will not do. Ignatia can take decisions, while cocculus cannot take decisions. Ignatia has no sensitivity to core sickness and motion sickness. Cocculus has a strong sensitivity. So cocculus children, parents will say that it is very hard to carry this child in the car. So the moment they go, I have many cocculus kids who the parents say that we have traveled just 2 kilometers in our car and this child is car sick. So they avoid going by the car. So Ignatia would dislike warm food and drink, while cocculus likes warm drinks. So these are the points which differentiate Ignatia and cocculus. So list is very long, sir. So would you like to take some questions on what I have taught, or should I go with more remedies?
Sir, another 5 minutes you can spare with some or either a case or a remedy. Then
Yes.
the question answer will take up at the end. Let them put it in the chat box.
Fine, sir.
Then together we will answer, sir.
Fine, sir. Fine, sir. So another very sensitive remedy is pulsatilla. So pulsatilla is very withdrawing, hyperactive, mental, non-aggressive remedy. Another non-aggressive remedy. So they are very thirstless, hot, we all know, obese kind of the children. They are obedient but non-diligent. So difference between pulsatilla and Ignatia would be pulsatilla is hot, Ignatia is chilly. Pulsatilla is diligent, Ignatia is diligent, pulsatilla is non-diligent. But both are obedient. So mild, bashfulness, clinging, weeping, touch me not is the main entry point of the pulsatilla. I'll show you a pulsatilla child, very clingy and very. This is how the pulsatilla will behave. So this is how the pulsatilla looks like. Weeping and chipku type. So typical pulsatilla child is shy and cling to the mother. She makes good contact with the doctor, but from safety of the mother's lap. Often the mother discloses that whenever the child sees an opportunity, she will come and sit on her lap and often ask her, "Mommy, do you love me?" So the tuberculinum and pulsatilla are the two remedies which are listed that blackmails, says, "Do you don't love me?" So this is an understanding of pulsatilla. Pulsatilla will have an assurance, will need the consolation, will need to listen this again and again, that he is being loved, he is being cared. So pulsatilla will be never detached from the umbilical cord of the mother. Mother is the sole point of reference for pulsatilla. Even at 90 years, pulsatilla would need a mother. If he cries, he will talk of, oh, my mother. He will remember the mother. Umbilical cord has never been truly detached, and if the mother is not there, then the child finds substitute like a teddy bear or a favorite blanket or sucks thumb. This comes into Calcaria also. She craves attention and affection. Pulsatilla is better by consolation, vulnerable to other children, easily bullied. So pulsatilla, what are the mental sensitivities? If you get the ailments from anger, so if pulsatilla get angry, he will fall sick. Pulsatilla, if angry or frightened, like cocculus, pulsatilla is also frightened easily remedy. Excitement, excessive joy. So pulsatilla will get sick after excessive joy or jealousy. And grief, sorrow, cannot cry, same as in Ignatia. Pulsatilla is very sensitive to rudeness of others. Pulsatilla is very sensitive to reprimand and criticism. Pulsatilla is very sensitive to moral impressions. So these are the sensitivities of pulsatilla. But what are the reactions? As we saw in Ignatia, reaction was withdrawing from the situation, going back from the situation. But in pulsatilla, reaction is clingy, carried desire to be. He will rather, mother is hitting the child and the child is hugging the mother. So mother will say, if you ask the mother, if you punish the pulsatilla child, your child, what he will do? He'll say that she'll come close to me. And hitting her, he'll come close to me. And rather I have to love her if I hit her. So pulsatilla, as I told, blackmail says, you do not love me when refused of anything. Causeless weeping is there in pulsatilla. Mother say that he just needs any excuse to weep. Anything will lead on to weeping, and weeping aloud with sobbing, and then you have to console the child. So he needs cares, caresses, kissing. He needs flattery. So once you scold the pulsatilla child, then you. So these are the rubrics already. They are not pediatric rubrics, but they are there into our repertory. Abrupt, rough, yet affectionate. Liar, mischievous. So pulsatilla can take this, while Ignatia will never take this, that he will be liar or mischievous. But pulsatilla will do that. And the physical sensitivities of pulsatilla is odor, music, noise, slight as clothing, head sensitive to pressure, throat sensitive to touch. Another very close remedy to pulsatilla and Ignatia is Calcaria mure. Though it is not a well-proved remedy, but in my practice, because earlier I used to get a Calcaria, and we know that Calcaria is not like natrum mure. But if you get a Calcaria with natrum mure like sensitivities, so you can use this remedy as a great tool into your practice. Calcaria mure is withdrawing plus hyperactive physical, non-aggressive. So he can be hot or chilly both, thirsty, one-sided, usually left-sided. Calcaria mure, like other Calcarias, is obese. He's again like pulsatilla, obedient and non-diligent. So very close remedy to pulsatilla. But the pulsatilla needs more of consolation. Calcaria mure will not directly ask for consolation. That is the major differentiating point between. So they are greatly attached to mother like pulsatilla. Greatly attached to the mother, come very close to pulsatilla. Whenever you think of pulsatilla, should always give a thought to Calcaria mure also. She wants to sleep with mother, requires help of mother in everything, and shares everything with the mother, Calcaria mure. If mother is late even by half an hour, she'll be very concerned. She doesn't want to emotionally hurt her mother in any way, and hence does activities to please her. She wants to complete attention. She wants complete attention and pampering, but not directly asking for it. That is the major thing between pulsatilla and Calcaria mure, that Calcaria mure will not ask for the care and attention. So Calcaria sensitivity is criticism. If he is affected, if mother criticizes her in front of others, will not like mother to compare her with other children. Like other Calcarias, what will others think of me? Timid, stage fright, fear of dark, will not go alone in the room. So that is Calcaria timidity, Calcaria fearfulness. So Calcaria mure grief is non-expressing, weeps easily if upset or someone hurts her. She will not weep loudly. like Pulsatilla. Another differentiating point between calcarea mure and Pulsatilla is Pulsatilla will cry loudly. Thermals, thirst, and sight, they are matching the Pulsatilla. But if the Pulsatilla child, you feel like it is a Pulsatilla, repertorization is favoring Pulsatilla, but child is not crying very loudly and to get the attention. So calcarea mure is not an attention seeker, while Pulsatilla is attention seeker. So instead, a mure part will make calcarea mure child to weep silently. So when angry, will not talk to anyone, go to corner and brood. While Pulsatilla, if angry, will come to where all are sitting and will show his resentment, will show that he has hit me. He has. If Pulsatilla and calcarea mure are playing together, and Pulsatilla or calcarea will hit. Pulsatilla will come to the mother, even if mother is sitting with everyone, and he will start crying loudly, and if parents are talking or if there are guests. So Pulsatilla will come there and take everyone's attention. While calcarea will go to the other room and sit
Sir, another
silently
2
and
minutes.
start brooding.
Sir,
Ji,
another 2 minutes.
fine, sir. So I'll finish off this calcarea mure. So reaction of calcarea mure is again caring and affectionate. Pulsatilla needs care while calcarea mure gives care. Will take care of younger brother, behave much matured than his age, understand other emotions and then consoles them. So calcarea mure is a kind of combination of Pulsatilla physical journals but carcinosin type mentals. So that is how we understand so there are so many other remedies. So Dr. Hegde sir has already asked me to stop. So I am stopping. So hope we'll take this step forward because this is a long presentation. I have taken around 40 remedies in this. So we'll be doing it on some other platform or the follow-up.
Sir, this is not stopping. This is beginning
Yes.
of our relationship as well as the learning and as well as teaching process. And
I hope I could.
first, I wanted to introduce Muktinder Singh to the whole KQHDA family, and that has happened today. And here onwards, it will continue. That is our pleasure.
My pleasure, sir. My pleasure. So I'm stopping here.
Yeah,
So please, I would like to listen to